everyone, I'm John C. Luna, and I'm here with my co-host,
Angelique Luna. I'm letting him take the reins this time because he's the one who's been talking a lot with Dr. Carrozzella in regards to the Florida Center of Hormones and Wellness.
So hello.
Hi there, how are you?
I'm doing wonderful. So tell us all about this first, because when I came across and saw it and first met you, I was really unsure of what kind of services are done here.
Sure. Well, this is a really exciting office. We do hormones and wellness here, and that's kind of the root of our name. And so basically what we specialize is men and women's hormonal therapy. And that runs the whole gamut of ages. My primary focus, and I see most of my patients somewhere between the age of 40 and 60, although certainly men and women over 60 require hormone balancing, and younger men and women require hormone balancing for a variety of different things. But the typical things that I will see here are menopause, or what's considered the women's hormonal change, or when they go from having their normal cycles every month to when they lose those cycles and start to have all of the hormonal imbalances associated with that. The other thing that I take care of is what's called low testosterone or andropause or men's hormonal imbalance. And we see a lot of men as well who have those issues, and we take care of them. Another interesting and very fun thing that we do here is sexual wellness.
What kind of procedures and services would you offer in association with sexual wellness?
Sure. Well, sexual wellness is absolutely a relatively new thing. And with the hormone rebalancing, people have discovered their sexuality at older ages. And as I mentioned earlier, a lot of things aren't working as well. And so what the sexual wellness is both men's penis rejuvenation and women's vaginal rejuvenation. And there's some really exciting techniques that we're using. So on the women's side, we use a radio frequency device called the Vivive device. And what it does is it produces radio frequency or sound waves that will activate the healing tissues of the vagina and bring in new blood vessels and new tissue that makes the sensation better, the lubrication better, the orgasms better, and it can even stop urinary leakage in women that are having that problem. It's dramatic and it's revolutionary. On the men's side, we have a device called the Gainswave or the pulse wave therapy. And what that does is it uses shock waves to energize the lining of the blood vessels in the penis, and it causes them to heal. And that healing response will bring in new tissue and new nitric oxide and a lot of the factors that are necessary for proper erections and erectile function. But beyond the mechanical and the electrophysiological devices that we use for the men and women, we have some very interesting new techniques that are using platelet-rich plasma and even stem cells. And we get the platelet-rich plasma, which is basically the healing factors from one's own blood. We purify that and inject that into the sexual tissues, into the vagina, into the clitoris, around the urethra in the women, and directly into the erectile tissue for the men. And that platelet-rich plasma can create a healing response that will restore sexual function in both the men and the women. And what's even more exciting lately is we've been starting to use some stem cells, and it's been dramatic, the responses that we got. So both for men with erectile dysfunction, we have an entire program from start to finish, from physiology to endocrinology to the healing factors to create erectile function improvements in men. And we have a whole program, a similar program in women, where we start with the endocrinological or the hormone balance, the physical healing with the platelet-rich plasma and the radio frequency device, and a whole number of other things that we can do as well to restore sexual function in women. For work, we ask everybody about sex, and we want people's sex life to be rich and rewarding. I frequently treat men with testosterone levels in the 500, 600, 700 range. In fact, most of my men I will treat to levels of about 11 to 1500. And even more importantly, I don't have any particular number that I look for. I look for an optimum result because I know, based upon the medical literature, that I cannot hurt someone by using testosterone. So It's more about how they feel than what their number is. And there's hundreds and thousands and probably millions of men who have been told that their testosterone is normal and they give up and figure that there's no hope for them. But I'm here to tell you that there's lots of hope. That hormone balance is more about taking care of a patient than it is about treating a number.
And just let me ask, are there any known side effects or negative effects that you've had in this?
Well, we're using your own blood, so there's no risk of infection. There's no risk of transmitted infections. About the only risk of an O shot or a P shot is that extreme minute risk of a puncture wound from a needle opening the skin and the remote possibility that there could be an infection. Okay.
So about the same risk as going to get a flu shot or any
That's
other
about
shot.
that's about the risk, right? That's about it. And we have all kind of different ways to get people involved and get them to get the proper treatment that's necessary for them. So unfortunately, we don't do insurance, but we do help people very much get the treatments that they need, and we work out programs to help them get that done. Thank you so much for coming by and talking to me and getting the word out, because it's getting the word out is important. There's so much negative press about hormones that's absolutely, to use a phrase, fake news. And the literature is just so solid that hormone therapy is good, it's healthy, it's safe, and it's effective.
Well, a thing